Hi, I'm Dr. David Barnett, and I'm a neurosurgeon in Dallas, Texas, with over 30 years of experience treating patients with spinal disorders. Today, I would like to talk to you about cervical disc herniations. And let's start with a little anatomy. The discs are the pads or the cushions that separate the bones in the spinal column. A disc herniation occurs when the cartilage that travels circumferentially around the disc has a tear or an opening in it that allows the inside of the disc to protrude or herniate into the channel where the spinal cord or nerves travel. Frequently, these symptoms start relatively abruptly, but not always. They can occur with spontaneous trauma or incidents that the patient clearly recalls, or more often than not, out of the blue. The most frequent symptoms include pain in the neck or paraspinal region, and if the nerve is compressed or pinched, patients will frequently experience pain, numbness, tingling, or even weakness down into their extremity, the arm in which that nerve travels. In severe cases, if the spinal cord is compressed, patients will frequently experience bilateral hand numbness. They'll experience clumsiness, lack of dexterity, or loss of strength in their hands on both sides. And in severe cases, they'll notice loss of balance or even gait instability, difficulty walking. Now, with the symptom onset, most patients will frequently see their primary care physician, or in severe cases, they'll even travel to the local emergency room. Medicines that are oftentimes initially started to reduce inflammation or reduce the amount of pain are usually anti-inflammatory medications or steroids. If the symptoms are severe enough or the patient has a neurologic deficit, a MRI of the cervical spine is usually ordered to establish a diagnosis for treatment purposes. Oftentimes, a referral is made to a neurosurgeon for a diagnostic and treatment recommendation. Now, most of the time, we will begin with conservative treatment recommendations. This includes anti-inflammatory medications and other medicines to calm the nerve down. Frequently, we'll refer the patients for physical therapy for cervical decompression, range of motion, maybe even strengthening, even referrals to pain management specialists for steroid injections or other medicines that can sometimes calm the nerves down. If the symptoms are severe enough, or if the patient has a neurologic deficit that warrants or the symptoms simply aren't responding to conservative modalities, then we will consider surgery. In a subsequent video, I'm going to talk to you more about the surgical treatment of cervical disc herniations. There are several options, and it is very important that you see a neurosurgeon that's conservative and has your best interest in mind. It's not a one-size-fits-all treatment. If you've been told you need surgery and you live in the Dallas-Fort Worth area, we'd be happy to see you for a diagnostic and therapeutic treatment recommendation. I appreciate your time today. This is Dr. David Barnett in Dallas, Texas. Thank you.